Hey everybody, welcome to the Athletic Potential Podcast. My name is Mike Matthews. I am your host, and today is episode 16. Today we are going to be discussing a case of lateral elbow pain in a youth pitcher. We're going to be talking about stabilization exercises for throwers, our stretching recommendations for most of our throwing athletes here at Athletic Potential, as well as our performance training programming and some of the general principles we use there. As a brief overview, we start each episode with a case. It's typically the last patient I treated prior to the recording of this episode. Then we jump into questions from our audience, and then we finish with a general recap. All right. Well, let's jump right into the case. And so the case today is an 11-year-old male right-hand dominant baseball player. He started having pain when he started to pitch a little bit more in his summer season, and he noticed that the pain was increasing as he increased throwing more and harder. And so then he went and saw a doctor. The doctor diagnosed him with Little Leaguer's elbow, and then referred him for treatment here at Athletic Potential. And so I saw him on his initial examination, and right off the bat, I kind of questioned the diagnosis of Little Leaguer's elbow. Now, granted, he's 11. He had pain with increased throwing. However, if we looked at his total volume of throwing up to that point in the year, it was quite minimal. He didn't really play he didn't play too many games in the spring part of the season. And in the summer, he was picking up more games and throwing more. And so he didn't look like the traditional pattern of an overuse type injury in regards to throwing. However, that does not need to always be present for a diagnosis of Little Leaguer's elbow. For those who don't know what Little Leaguer's elbow is in the youth clients, their growth plates are still open. If you ever get an x-ray on a child, you'll see there's space in the bone. It looks like they're missing part of their bone. That's called the growth plates, where the bone is laid down and then forms out from there. And there are different growth plates for different parts of the bones, depending on where we're talking. And so in the elbow, there's one on the inside of the elbow here, and it grows out. And any type of inflammation of that growth plate, specifically due to sports, traditionally with baseball players, softball players, and gymnasts, then they can get a diagnosis called Little Leaguer's elbow, or more formally known as apophysitis. It's an irritation of the apophyseal joint or apophyseal joint. So anyway, so this kid comes in, and he's given the diagnosis Little Leaguer's elbow, and right away the volume didn't look right for maybe sort of Little Leaguer syndrome. So I kind of had a little inkling that maybe we weren't dealing with a traditional case of this. And then it was definitely given away when I asked him. We started talking about his pain. It hurts when he throws. It doesn't hurt when he doesn't. Maybe aches after he throws. So we're definitely dealing maybe with a bone injury, because it didn't just completely stop once he stopped throwing. It seemed to ache and continue as time went on, later in the day. And what really gave it away is most likely not Little Leaguer's elbow for me, is his pain was not located on the inside of his elbow. So instead of being here, where we're traditionally, for those on the podcast, you can't see where I'm pointing to the inside of my elbow, where the bone is, and his pain was not coming from there. His pain was actually coming from the other side of the elbow on the back side, on the bone on the other side. Traditionally, a site for most people, they would say they get like tennis elbow type symptoms. And so when I saw that his pain was more on the outside of his elbow and not on the inside, I started wondering if this was really a traditional Little Leaguer's elbow. And we did more testing. He definitely didn't test positive for any tendon issues, muscle issues, or anything like that. He tested negative for tennis elbow. And when it came right down to it, when I really examined him, he definitely had bone-related pain. And so I tested his elbow into valgus, or I tried to stress the inside of his elbow and kind of pull it apart and gap it. Take the two bones here and spread them apart on the inside of the elbow. And he reported pain on the backside of his elbow. And that led me to a diagnosis of basically the bones on the backside of the elbow. When you go to throw, the front side of the elbow opens up because of the stress of the layback position. And then not only does it open on the front side of the elbow, but on the back side it actually closes and compresses. And so what happens in this case specifically, I think what happened is as he was throwing, he has a decent amount of mobility, flexibility in his elbow, and the inside of the elbow gapped, and then the backside of the elbow pinched. And what happened is he pinched the bone enough times that he started getting irritation and pain, and then that pain kept radiating and kept getting worse to the point where he was unable to throw. And so we gave him that diagnosis, more of a bone problem on the backside of his elbow, which is more of a product of that he could not dynamically stabilize the inside of his elbow. He couldn't, the muscles on the inside of the elbow, that flexor pronator mass, those massive, the massive muscles on the inside of the forearm were not adequate to control for that gapping of the elbow. And so once we identified that, I told him, look, we need to not throw to decrease the pain you're having in the bone. However, what I would like you to do is start doing some exercises for these muscles in the forearm, and gave him very specific things, specifically more gripping and a few isometric exercises to really work specifically what's called the flexor carpi ulnaris and the finger flexors, to see if we could improve his ability to decrease the gapping in the front of the elbow, and then subsequently decrease the impaction or the pinching in the back of the elbow. For those wondering, we tested grip strength. It was equal side to side, but when you looked at the total number for an 11-year-old, I kind of would expect him to be a little bit stronger. And that's just because I feel like I've had a lot of experience with 11-year-olds or kids his age and his body type and body size. And the other thing I wanted to do is I tested him in simply just his ability to hang. I felt like that would give me a lot of information about shoulder strength, shoulder endurance, elbow strength, grip strength, those type of things. So I had him get up on a pull-up bar, and I had him just try and hang and see how he did. And to be honest, he quite really struggled, indicating that his grip strength was quite poor. You just see the kid you could barely hold on to the bar for about 5 to 6 seconds, then had to come down. So I kind of classified him as just generally weak, specifically in the flexors and specifically the grip muscles of the forearm. And so we put him on a program that he was supposed to go do twice per day. He did that for a week. He came back. We retested. He was able to hang for 30 seconds. By the way, we did give him hangs to do at home, and he did those. He was able to hang for 30 seconds. We retested his grip strength. It was up fairly substantially, I would say, for a week, mainly from neuromuscular changes, but still up. And then I retested his elbow, and his elbow pain was substantially less. So when I stressed his elbow, we couldn't get the pain to come back on the outside. So I gave it another week off of throwing, and kept working muscles on the grip muscles and hangs and those type of things. And then I said, hey, look, in clinic, I had him come back and we did some throwing. So I actually had him start with a youth football just to see if we could. I just didn't want him to be afraid of a baseball. So I gave him a youth football, had him throw the youth football. He had no pain. Mechanics looked pretty good. And so then we transitioned to a baseball, and he was able to throw 10 to 15 times. No pain at moderate effort, nothing substantial. And so I told him, look, here's your program. We're going to go and do a throwing program, and it's going to be a gradual return. He was done playing for this current season in the summer, and so I told him we were going to do a slow ramp up. He had just tried out for a team that would start playing in the fall. I recommended that if he was going to play in the fall, that I would recommend that he play a position, and then could look at considering maybe pitching in the spring, just because I feel like his volume of throwing was poor, and to be honest, he needed some mechanical work as well, some coaching. So I felt like using the fall to teach pitching and teach mechanics, not in a competitive game scenario, but more in a structured practice, structured drills, those type of things was more effective for him, and it gave the bone more time to improve. And so I knew we needed to give the bone about 4 weeks to totally improve. And so upon his last visit, which was 3 weeks into his treatment now, he has no pain with throwing. He's throwing 30 times at a distance of anywhere from 60 to 75 feet at a 60% effort. I'm not sure how 11-year-olds do when I tell them, hey, throw 60%, and I threw with him, and to be honest, he's not throwing 100. He's not throwing as hard as he can, but he's also doesn't look like he's babying it either. So that was kind of a good thing to see, is he didn't look like he was afraid of it. So that was a good sign. So interesting case in that usually when we see elbow pain in 11-year-old kids following because of pitching or an increase in pitching or throwing, we almost immediately suspect the little leaguer syndrome, growth plate issues. However, in his case, we demonstrated that he just did not have good stability through muscle control of his elbow, and that was causing some bone problems on the backside of his elbow. And he's still in his progression, and we hopefully will be able to see him continue to progress in the future. So, all right, that does it for our case. And so we're going to transition over to question and answers at this point. And if you do have a question for the podcast, please visit the website www.athletic-potential.com/podcast. There's a button that you can hit. It'll say ask or submit a question. It'll ask you to input your email and your question. Just know you're not required to put an email, but I do recommend you give us an email because I feel like I answer a lot of questions more individualized for each person that does ask questions. And I try to make sure that the questions that make it to the air here are a little bit more general. There's some questions I can't answer very effectively in a podcast, but I can answer very effectively individually. So please input your email if you feel comfortable doing that and submit some questions. We want to make sure we answer any and all questions as much as we can. The more questions we have, the more questions get answered generally for those listening. So, all right, we're going to jump into our questions. So question 1 comes from Kenzie. Kenzie asks, I understand that that individualization for each athlete is very important, but is there an exercise that you find yourself using on nearly every athlete or client? This is a great question because we quite frequently go over our programming principles here at Athletic Potential to make sure that we're advancing based on general knowledge and what's been working, what's not working. And so when we do this, we actually look and say, hey, why is everybody getting this exercise? Are we just getting complacent? Or are we just getting, I hate to use the word lazy, but is it just easy to program that exercise and that's why we're doing it? Or is it that effective and we want everyone to be doing it? I can tell you this, that it's hard to answer in a very specific exercise, but I can tell you that the framework almost never changes for our clients. Almost all of our clients will start their training sessions with some form of soft tissue work, whether that's a foam roller, Theragun, it doesn't have to be Theragun, it's any percussor gun, lacrosse ball, any type of the rolling that you can normally do, those type of things. We have a lot of different implements that our clients use to help just kind of work out knots in areas of feeling like they're stiff or sore, or maybe they just don't feel like they don't move as cleanly as they want to. And so we usually average that out to around 5 minutes of soft tissue work. If we give it open-ended, we'll have guys working on that for 25 minutes, which is way too long. And so we usually do 5 to 7 minutes of soft tissue work. And it's immediately followed with mobility work. So a lot of people would consider this like your stretching type stuff. I can tell you this, that almost all of our clients will start in what we call 6-point rocking position. That's hands and knees, and your feet are on the ground as well. What this does, it looks like they're just kind of pushing their hips back into their heels, keeping their spine straight. The reason why most of our clients use this exercise is it's a great way to flip the switch on the core, make sure that the posture is good, make sure the head and neck are in the position they need to be. Most everybody's already on the ground from soft tissue work, and so they just go right into it, gets the hips moving without any undue stress, and most everybody starts with that 6-point rocking position. And then from there, I'll be honest, it deviates dramatically for each client, although it does still remain in the mobility category. Some people will go and work on groin mobility, others hip flexors, hamstrings, quads, triceps. I mean, you name it, we do. It really is, at this point, we look at the athlete and say, hey, we know that you tested very well for your adductor group and your inner thigh muscles. However, my goodness, your glutes are beyond tight. Your rotators, of your hip are tight, or basically you just don't know how to get into the hip very well. So we're going to use this mobility time anywhere from 7 to 10 minutes to really improve your ability to move. And so I would say in that categorization, Kenzie, we definitely use 6-point rocking with nearly all clients. I really like it for youth athletes, to be honest, because I can actually get them into the correct postures and teach them to move in the very basic sense in a quadruped position, and they actually do fairly well with it. So our youth clients almost always do it. So 6-point rocking is probably the only one in mobility category that I think most of our clients are using. From there, we go to activation. We typically at this point want to turn muscles on. Now, I like to have most all of our clients do some form of abdominal oblique activation exercise, a glute activation exercise, and typically a posterior shoulder activation exercise in this this part of the training program. It is highly individualized. I would say that we use hip thrusters quite a bit. So hip thrusters are usually involved. We use what's called a curl up. You can look up Stuart McGill's work. He calls it a curl up. It looks like a crunch, but it's not a crunch. We use a curl up quite often. And there's a lot of times we'll use side plank in this position as well, as I feel like it activates the obliques fairly well, although we definitely have some variation there. I like that the side plank activates not only the obliques, but also the hip or the glute medius, the hip abductor, which I really like that. Posterior shoulder, we do so many different type of exercise, and we try to couple that programming with something that the athlete doesn't do very well when they're standing. I don't know if I really can describe that but essentially I don't have them do like shoulder pinches or retractions for everybody. I really like the idea of having them do reaches if they're not a good serratus anterior activation of the muscle that lives on the rib cage that helps elevate the arm. If they do fairly well with that, but maybe they have low trap issues, then I'll do some retraction or protraction, maybe with some depression of the scapula to try to get the low trap to go. So that's a tough thing to say that we use on everybody. That one definitely changes for the majority of people. So moving on from there, we typically go from activation to a dynamic warm-up. Our dynamic warm-ups are heavily variable based on the age, sport type, and experience level of the athletes. I don't know if I can exactly tell you. I'm trying to think if there's an exercise. There is an exercise that we call the spider that most of our clients do. I believe it's on my YouTube channel. You can look it up there. And it works rotation of the hip. It works flexion of the hip. It's essentially a Swiss Army knife of mobility for the dynamic warm-up. I like it because it challenges the athletes to control certain body segments while they move other body segments. And realistically, it challenges their brain. It really starts focusing them in to be able to understanding how they're moving and making sure they're moving correctly. We heavily coach our dynamic warm-up because I feel like if they start really poorly there, then their training session is the same. They're just, the quality of their movements is just not as good. And so we do quite a bit of coaching in the dynamic warm-up. Unless they look great, then we let them do their thing. So training-wise, we've talked about this. I take a lot of my programming design from Dan John. We hinge, we push, we pull, we squat, and we carry. And extremely variable in exercises, all definitely dependent on the athlete at this point. So that's a tough one, but that's the general framework that we do. And it's a good question, Kenzie. So what I would tell you is that from a general principle standpoint, our assessments tell us a lot about our athletes. And then when they get in group settings, we specifically program in ways to improve that individualization. And it's usually like they may do 3 exercises in a circuit, and the first exercise is a push. Everybody does the same thing. It's a push-up, right? And then the second exercise is a squat, and everybody's doing a goblet squat. The third exercise is what we would call a shoulder stabilization exercise. And based on how they tested, they may be lumped into 3 different categories. And those that are in the category A would be doing this exercise, B would be doing this exercise, C would be doing this exercise. And so that's one way to individualize in a group setting that has worked pretty effectively for us. So this just made me think about when I talked about shoulder stabilization exercises. Realistically, Kenzie, one of the things that I do with almost every one of my rehab clients and a lot of our other just training clients, specifically our pro guys, is, and it's not just because they're pros. I do it with the college guys and the high school guys too, but I've seen a more dramatic improvement with the pro guys, and I think it's because of training. They've done so much arm care, shoulder care, elbow care, all that kind of stuff, whatever you want to call it. They've done so much of it that they need some form of what we call rhythmic stabilization. It's the ability to, basically what happens is I have them hold their arm in a position, and I come in and I try and move their arm, and their job is just to hold it still. And they can't anticipate it. They don't know when it's coming next. They don't know how hard I'm going to push. They don't know if I'm going to go really soft or quickly transition. They don't know exactly what position I'm going to put their arm in, and it really works on that stabilize on the shoulder stabilizers or whatever muscle group that we're trying to improve. And I can tell you this, on rehab side of it, I'd say 95% of my rehab clients, regardless of what they're here for, are doing some form of rhythmic stabilization with me. I think that's probably, if I could give you one thing, that's probably the thing that I do the most with almost everyone, including our non-rehab clients. We do a ton of stabilization work with all of our baseball players when we can. I've even taught teammates how to do it for each other, and so that they can do it on the road. And it's been highly effective. And so I'd say that's something that I would definitely recommend, finding ways to improve or increase the consistency of someone doing those rhythmic stabilization or dynamic stability type exercises. So, Kenzie, great question. I hope I answered it. And yeah, it's always fun to go back to our programming and look at our exercises and go, hey, what happened to this exercise? We're not doing it anymore. Was it terrible, or was it just terrible to program because it was just inefficient, or it took too long to set up? Or those are fun things to do in regards to programming. So thanks for the question, Kenzie. All right, let's move on to question 2. This one is from Jackson, and he asks, what are your go-to stretches for your baseball, softball players? How often should they perform these stretches? Well, Jackson, you're going to get the answer I give everybody, and that is we highly individualize our mobility and stretching routines for the athletes. I can tell you this, and I know some of my colleagues in the PT realm would disagree with me, but I can tell you in the past 2 years, I have manually stretched, so me doing the stretch, manually stretched 2 hamstrings. I don't stretch those manually and statically anymore. I just have found that 1, they don't really do anything if I do it, and 2, I've made a couple of guys worse. They've seen back pain come back immediately following it, and it just either is completely ineffective or it made it worse. Now, there are guys that have problems with hamstring length, and there's ways that we improve that. And I think I'm bringing this up for you, Jackson, mainly because I think it answers the question, and that is when we talk about stretches, a lot of people think stretches, they think sitting on the ground, reaching to their toes, or arm up behind their head, or arms across their body in regards to throwers. I only have our throwers do that if they've demonstrated a lack of mobility, specifically that is muscular and not capsule or any of those other things. I only have them do that if they've demonstrated a muscle inflexibility issue, and that we can't get it what I would consider actively, meaning they can't do some active movements that then improve their overall mobility. I can tell you this, that the majority of our clients are not static stretching. The majority of them are doing what we call active stretching, where they're moving through movements to improve their mobility and flexibility in those positions. And so, Jackson, I don't think I have any go-to stretches. I know that there's some recommendations out there that all throwers will get, maybe posterior shoulder tightness, and so they should do the crossbody. I have not seen that to be completely the case, although I will tell you that there's quite a few guys that are doing a similar type mobilization, active stretch with us to target that position, or to target that specific muscle group. A triceps, I don't even go there because most of the guys, when they do tricep mobility work, we don't statically stretch them, we actively move them. And what we find is that we gain all of their mobility back without even static stretching them. I will tell you that the area that we've noticed the most, where we feel like most of our players have to spend more time in, which would be more kind of towards that static holding, sitting and holding a position or whatever, is in the hips. There's a couple hip stretches that we typically use, the 90-90 hip stretch, and even though we do couple that with some active movements, lifting and rolling, that kind of thing. But I would say that there are times where it's like, I think it's called pigeon, like you see that in yoga or something. Like we do that, but on a very specific nature for baseball players, specifically targeting the hip only and trying to leave the lower back and lumbar spine out of it. Jackson, is a good question, but I can tell you right now in regards to stretching, we just don't do a lot of what we would be traditional stretching. I can tell you this. I have an 11-year-old girl who plays softball. And the first year, I guess it was the first couple of years that she was playing softball, I did not coach her team. I was kind of an assistant or I volunteer coached when I could, but she had a couple of different coaches that were in charge. And one of the things that I recommended that they change was that they had all the girls go out and they had all the girls throw first. And then what they did is they brought them back in and then they had them stretch and then they had them run. And in my brain, maybe I'm missing something here, but that seems totally backwards. Throwing is the most intense exercise they're most likely going to do on their arms. And so if anything, that should be the last thing they do. Should run first and maybe stretch second and then go to third. And what I ended up doing was I recommended, said, hey, have them go run first. That brings them together as a team. And then when they get back, maybe we can do some different exercises and basically have them go through a dynamic warm-up. They're 11. Like, I know they're not going to be perfect, but the idea was to bring them together as a team and get them to turn certain muscle groups on and become coordinated enough that when they started throwing, that they would be able to use the correct muscle groups. And the best part about it was when we started seeing this, we started seeing the change in this. The biggest change we saw was that their catch play ability immediately following this improved. They were not good. This is 10, 11-year-olds. I don't expect perfection out of these girls, but they were 10 and 11. They had a hard time throwing it to each other originally. And then we did these things, and quite simply, they didn't improve any other mechanics of throwing. All they did was get their muscles firing in the right positions and or the right timing, and they had better sense of their bodies. And all of a sudden, they started throwing the ball to their partner and not completely over their head or into the ground. So kind of a fun little anecdotal thing that I saw just with youth athletes, right? And so I don't think we need a lot of stretching. I don't think it's something that needs to happen a lot. I think it needs to be highly individualized, and we need to make sure that we're stretching the right things for the right reasons. And so a bit of a long-winded answer for you, Jackson, to basically give you no stretches in regards to go-to stretches, but I can tell you this, that a good assessment followed by a good prescription of mobility work, whether that's stretching or whether that's active stretching or whether that's movement training, is highly effective. We definitely do that with every single one of our clients that comes in. So good question. If you have follow-up questions to that, let me know. And and to answer your second part of that question, how often should they perform these stretches? Daily. Yeah, every time they come into the training room or into our performance center, anytime they are with me, we're constantly doing mobility work. So it's something that I think they need to work on every day. It's part of their home program. Even if they're not training that day, they have a home program that typically has some mobility work just to teach them to move and keep them moving effectively and efficiently. So good question, Jackson. All right, let's move on to our third question. This one's from Sarah. With your training clients, what type of finishers do you like to use? Finishers. Okay, so I can tell you this. I think I know what you're talking about with the finisher, Sarah, and that's basically like, hey, we're at the end of the session. We've got 10 minutes. What are we just finishing our clients off with, right? And I can tell you right now that when it comes to finishers, I would say that the general fitness population is like, oh yeah, let's gas them. I want to be gassed. I want to be buried in the ground. I want to be limping out of here because I'm so tired. I can tell you from a performance training standpoint, with athletes more specifically than anybody else. Now, I'm going to be very specific to athletes that are trying to improve their ability to perform on the field of play, court, whatever, right? That I don't enjoy completely depleting them of energy at the end of a workout. I've always believed and seen better results, and it's been consistent for years now with the fact that I like the idea, and I believe this idea came from, I'm going to misquote it. It came out of a book by Pavel Tsatsouline, and it said that the workout should give you more than it takes. And I just completely misquoted that, I'm sure. But essentially what happens is that I want my athletes leaving the training performance session feeling better, feeling good, and ready to do it again the next day. And if they're just gassed, I'm not sure that's the way I want to do it, especially with most of these players. Obviously baseball, softball is kind of our thing here. But most of these guys are working out in the morning and then they have practice. And so I cannot deplete them of energy and then expect them to go out 3 hours later and perform the highly skilled movements that are associated with their sport. Even if it's soccer, football, it doesn't matter the sport. They're all going to have highly skilled, specific movements that they're going to need to do. Now, I'm not saying that doesn't mean that the workout shouldn't be grueling and shouldn't be tough and shouldn't be hard, but they shouldn't be walking out feeling sore. They should be walking out feeling like they're moving better and their muscles got a good workout. And that's something it's been a big goal of mine. So in regards to finishers in that sense, in the sense of like, hey, we've got 20% less than left in the gas tank. Let's take all 20, I can tell you back in the day, I used to do that. And I think the only benefit I saw out of that was mental toughness. And there's something to be said about maybe throwing a session or two of performance training in where they're going to have to grind and they're going to have to find a way to get through it. However, I can tell you from a baseball, softball perspective, it's not to the point where they're dying of fatigue. I want them to be able to perform at more of a specific movement pattern and done well, and to perform with more exact quality. I probably should just give you an example. Like, we'll do med ball throws, but they have to throw to a target when they're tired. I mean, they're going to have to throw when they're tired. They're going to have to make a throw across the diamond to get somebody out in the ninth inning when they've been playing all day and it's hot. They're going to have to make that throw, right? Or pitchers they're in the, they're 70 to 100 or 70 to 80 pitches, and they got to get a guy out, and they got a 1-2 count, and they got to make a pitch here. And if they don't, then maybe they're not going to pitch the next hitter. And so, yeah, I don't mind training them in a situation where they need to make sure that they can try to at least maybe simulate it mentally, like, hey, I got to do this job here in the weight room, and maybe that'll help transfer to the field of play. But I don't like depleting them of energy like the finishers would necessarily be. So that's the first part of my answer, Sarah. The second part is, okay, so then how do we finish our exercises here at Athletic Potential? I can tell you right now, and I'll actually give you the example of the training group today. So high school group, high school baseball team, ranges anywhere from 20 to 30 players at a time. And so we went through our normal routines, did the warm-ups, all that kind of stuff, did the workout, did the lift, we did the circuits, and we finished. We had about 10 minutes left. And I programmed specifically to have 10 minutes, right around 10 minutes left in most of my workouts. Sometimes we go way over and we may not even get to this. Sometimes I wouldn't say we're really ever way under, but sometimes we're under and we can work into these things a little bit more. However, so today, in the workout, we had done a hinge, squat, push, pull. So we've done those 4. We had not done any carry. We've done specific core and shoulder work, baseball players. And we hadn't done any carrying or grip work yet. And I kind of like the idea with these guys. I didn't want to give them anything super technical because I'll be honest, they were a little bit tired. The workout was a bit of a grind, and they were looking a little bit more on the tired side. And so I looked at them all and I said, hey, everybody knows how much they weigh, right? And they all agreed, which was a bit surprising. And they all knew how much they weighed. And so, okay, take your body weight, divide it by 2. Now, go find a dumbbell that is the closest to that number as possible. And so they'd go pick up half their body weight with a dumbbell. And then I told them, like, all right, here's a starting position in the weight room. You're going to go out the front door of the weight room. You're going to walk around our full turf facility. The turf facility is essentially 110 feet by about 120 feet. And I told them, you're going to walk around the edge of our facility. We have cages in our facility, so I actually just had to walk around the edge of the building around the cages. And I said, you need to walk from the starting point out the front door of the weight room, walk all the way around to the back door of the weight room, and then re-rack your weight. That's what you're going to do for the next 10 minutes. And they carried half their body weight for that distance. And I noted I was standing at the back entrance to the weight room, and I was standing next to a player that I had been doing some rehab work with, and he'd been doing some training with me in the past, and he was looking at these guys, and I was looking at these guys. And my favorite part is our high school baseball team, and the carries they were excited. They were hopping out the door. They were just like, yeah, let's go. And they were carrying, and there's a lot of chatter. And I can tell you, towards that last leg where they're finishing the turf walk and starting to get closer to the weight room, there was not a soul talking. And I don't think it was because they were gassed. I think they couldn't breathe enough to maintain the carry, and so they just decided not to talk to each other. And so they finished, and then when we finished, all of them kind of resumed talking to each other again. And I looked at it as, hey, look, they're not so tired that they can't even talk now. All of them are still able to carry half their body weight at the end of our exercise and walk out of here with some energy, because now they're talking and they're happy necessarily the workout's over, but they're transitioning. And I felt like we kind of got the right idea. That's a really great way to end the workout, is to have that last little bit, that last 10 minutes. It's typically, in our case, it's a carry. I like to finish with carries. They're a little bit lower technical, not that hard to coach, and we can really program them well. If they've had a ton of grip that day, we can do different carrying variations. There's a little less on the grip, but I like carries to finish. So to answer, kind of go back to your answer, what do our finishers look like? Typically, there's some form of carry, and it really is just depending on making sure that they walk out of the training session feeling good, feeling like their body's got a good workout, but that they feel good and they're ready for whatever the rest of the day is going to bring to them, as well as maybe the next day. So, Sarah, I hope that answers your question. It's an interesting thought. We talked about programming quite a bit today, it seems like, and my big thing on programming is that we got to make sure that, again, that our athletes feel better when they leave. It's something that's really important. And I know from a baseball, softball, overhead thrower, volleyball, javelin, they need to feel like they got to work out, but they need to feel like their body is tuned up and ready to go. Maybe not so much like they're completely full of energy, but more like they actually feel like they're moving better than they did before the session. And so that's how we would judge these exercises. And judge our programming. So great questions today. I really appreciate the questions. Just a general recap, looking back, our case, we talked about elbow pain in a youth baseball player, and we found that he just needed more strength and probably a nice little ramp up throwing program, and that it definitely, you need to assess every time. You can't assess, you got to assume, or sorry, you need to not assume, you need to assess and make sure that what may be being said by a doctor is correct, and in this case it was not, and so that's okay, and he's doing well. So in our question from Kenzie, we talked about exercises that we do with most of our clients. We talked about soft tissue work, we talked about activation, dynamic warm-up, and we talked about shoulder stabilization exercises. That's typically something that's done with every one of our athletes. I would say actually the majority of our athletes, with the exception of maybe we don't do a ton of that with soccer players, but we do some with our soccer players. And so that's a good question. Jackson asked about stretching. Highly individualized. I prefer active stretching over passive stretching when appropriate. And if we are going to passive stretch, then it needs to be highly individualized for a specific purpose. And what I didn't add earlier was a specific end date. It's not forever. We want to make sure that if we are static stretching somebody, that we're static stretching to the point where we've achieved enough flexibility in the region that we don't need to worry about getting any more. So, and then Sarah, we talked about finishers, and essentially we finish with carries and making sure that our clients walk out feeling like their bodies are moving better than when they walked in to the training session that day. So great questions. That was a fun episode. I really enjoy these questions when it makes me really think about our programming and just kind of the way we do things. And it's always fun to talk about those things. So I appreciate those that have submitted questions. If you do have a question for the podcast, please visit www.athletic-potential.com/podcast. There's a button you may submit a question there. And then, please rate and review. Tell your friends about the podcast. Anybody that would, maybe benefit from this, please tell them to come on and listen to the podcast and give us some feedback as well. If we need to improve a few things, if sound quality or anything like that doesn't seem to be good, please give us feedback. We definitely want to make this an enjoyable experience. We want to answer as many questions as possible and help out as many people as we can. And that does it for episode 16, and we'll catch you next time. Thanks.